Hello. Hello. All right. Hello, everyone, and welcome back to Nurses Lecture Room Evening Live. If you're coming across this channel for the first time, my name is Mercy Mary. I am a registered nurse and a registered midwife in Nigeria. And on today's live, we're going to be talking about hepatitis B. All right. If you have been following us on our live sections and our live series recently, you will find that there was a poll yesterday during our live section on what we are going to talk about, and most people voted for hepatitis B. So if you were here on our live sections yesterday, you will believe we are answering that particular hepatitis B questions tonight, and we are going to be sharing with you everything you need to know about hepatitis. So if you have hepatitis, or you have someone that have hepatitis, or you just want to have a knowledge of what hepatitis is all about, I will advise you to stay back and listen to every hook and cranny of this live section. It actually promises to be engaging and also to be interacting. Your health should be your priority. So when it comes to health, I think it is very, very important for we to take it in high esteem. So if you are watching this live right now, I will appreciate if you drop on the comment section and let us know where you are watching from. I am Miss Mary and I am in the UK. I am streaming live from the United Kingdom. Kindly let me know where you are watching from in the comments section. So we have Sisha, and Sisha TV said, can a partner get hepatitis B if the other person's viral load shows non-reactive? So all these things are going to be explained in our live video. So I will just allow us to wait and see how it goes. Oh, what view? Yeah, I was expecting to see you here. Thanks for joining. Thanks for joining our live world view. So we are here to take all your questions today. So we have worldwide view. We have mom brains, less muzzles. That's interesting. Mom brain, less muzzles, watching from Nigeria. Hello, how are you doing? Worldwide view is watching from Nigeria. Slimry is watching from Nigeria. I think I saw worldwide view yesterday on our live, and also Slimry was on our live yesterday. Thank you all for joining our live video. So let's keep it coming. We have about 23 people watching now. Can you let us know where you are watching us from? Watching from Cameroon. That is good. It's nice to have you here. We have MD Tush. Hey, I'm from Bangladesh. Hello, how are you doing? Then we have Wizo watching from Cameroon. How are you doing? Trust you are doing great. Then we have Solitude. No mercy. Please have mercy on us. What drugs are you on? I'm not on any drugs. I'm not a drug addict. Or are you talking about those on those that are having hepatitis? So we have MD Tusha. Do you know this country? All right, I don't know what you're talking about. Then we also have Agie Achemfo. I don't know if I pronounced that name correctly. He said, keep that momentum going. Thank you very much for that beautiful comment. Then we have Wizo. I'm doing good. It's nice having you all here on our live. So welcome to our live. And if you are watching this live, our live series for the first time, kindly drop on the comment section and let us know this is your first time. And also kindly subscribe to our YouTube channel and turn on the notification button anytime we come on live, so you can watch our live section. So we are going to be going straight into the point. So we have Ife Yuwan Chukwuemeka. Hello, how are you doing? We have Ola John. Good evening, everyone. Good evening. Then we have Vizo. Vizo said, my first time. Nelsie said, it's my first time. Thank you very much for joining Nurses Lecture Room Live. And don't forget to subscribe to our channel and check out all our previous videos. So I'm not going to, okay, I'm saying, do you know Bangladesh? I've heard about Bangladesh, but I've not been in Bangladesh. All right, so more brains, less muzzle said, my first time. Thank you very much for joining our live. And also don't forget to subscribe to our YouTube channel. Okay, Slimri says, double tap your screen, everyone, to like the live. Thank you very much, Slimri. Thank you very much. At the end of this live section, or before the end of this live section, we are going to be doing a poll of what topic to discuss about tomorrow. By the end of this live section, we're going to be doing a poll of what topic to discuss about tomorrow. But today, it's more on hepatitis. Sorry, it's more on hepatitis. So let's start from the basis. What is hepatitis? What is hepatitis? So I'm not talking about hepatitis B now. In science, in medicine, when we're in school, they tell us that, do you spit or swallow? I don't understand what Solitude is saying. Okay, in medicine, in that when we are in nursing school, they'll tell you that whenever you hear itis at the end of any disease condition, it simply means something is swelling, something is inflamed. So hepatitis in a layman's language simply means there is an inflammation of the liver. There is a swelling of the liver. For example, the liver is like this. So when the liver is affected, it swells. You know, when you have a cut in your leg, when you have a cut, okay, let's say I have a cut in my hand, or I have I have an infection. You see it swells. There's an inflammation as a result of infection. So if you know liver is an organ in your body. So when it is infected, it becomes inflamed, it becomes swollen. And that is what is known as hepatitis. The liver is being affected. In hepatitis, what is being affected is the liver. So inflammation or swelling of the liver, I'll use it like I'm breaking it down as much as I can, is known as hepatitis. So there are different types of hepatitis. We have hepatitis A, hepatitis B, C, D, even alcoholic hepatitis as a result of too much alcohol can actually affect your liver. So there are different types of hepatitis. Some are sexually transmitted, some are transmitted through blood, and some are transmitted through food. But what our major focus today is hepatitis B. And hepatitis B is caused by hepatitis B virus. Hepatitis B is caused by hepatitis B virus. The next question you will want to ask is, how does this hepatitis get into our body? How does this hepatitis infect our body? Hepatitis B can actually affect your body through body fluid, through blood, through semen. Hepatitis B can affect our body. So hepatitis B can be transferred through unprotected sex. Hepatitis B can be transferred through unprotected sex. So for the men out there or for the women out there that like to skin, that like having sex with people that they are not aware of, I just want to let you know that hepatitis is a disease that affects the liver and can be transferred or transmitted through sexual intercourse. It can also be transferred or transmitted through sharing needles, razors, or toothbrushes. We all know that these needles, these razors, these toothbrushes, so when you brush, someone brush, there is blood coming out, and you take the brush, you use it immediately, or the razor, there is blood. Sharp objects is similar to HIV. Sharp objects can transfer hepatitis B. Hepatitis B can also be transferred from mother to children, to the child through childbirth. It can be transferred from mothers to baby through childbirth. That is why it is very important as mothers, they should get their blood screened so that they know safety precautions to be taken in order to protect the baby. So I believe I'm making sense. So we have Linda Emily said hi. We have Rabbi Kim said hi. And we have Idem with their testimony. How are you doing? Trust you are doing great. It's nice having you on the live section. So, and also there's this particular one, hepatitis B can be transferred through blood transfusion. But this is rare because most times before a blood transfusion takes place, they usually screen the blood. So having hepatitis B through blood transfusion is very, very rare because no hospital will transfer or transfuse you with a blood that they don't know if it has hepatitis or not. So I think one of the major way in which hepatitis B is being transferred is actually through unprotected sex. There are two types of hepatitis B. Remember, there are different types of hepatitis. In terms of hepatitis B, there are two types. We have the acute hepatitis B, and we also have the chronic hepatitis B. For the acute hepatitis B, the liver is being affected, but your body, your immune system is able to fight it. People's body, they can fight it and it goes away. You won't even know you have it. While for chronic hepatitis, as the name implies, chronic, it's a long-term infection. Your body cannot fight it. It's long-term. And if care is not taken, it can lead to liver damage, liver cirrhosis, and liver cancer. It can lead to what? Liver damage, liver cirrhosis, and liver cancer. And here's the shocking thing you need to know. About 296 million people, it's not just you. For those that have hepatitis, you are not alone. About 296 million people worldwide live with chronic hepatitis B. About how many? About 296 million people worldwide live with chronic hepatitis B. And most people, they are unaware. And do you know why? Because some people have this hepatitis B and they don't show any signs at all. So it's not something that will affect you and you will be like, oh, I'm seeing the signs and symptoms. I need to see the doctor. I need to get treatment. Some people have this hepatitis and they don't even show any single sign at all. That is why people are being advised to go for regular screening, get their blood tested, especially if you are an individual, you know, you usually have a multiple sex partner and you have unprotected sex. It is very, very important for you to go for regular blood screening because people have this hepatitis B, they don't know they have hepatitis B. And when somebody that doesn't have hepatitis B have sex with them, it is easy for them to transfer it. So please and please let me know in the comment section if you are following. Let me know in the comment section if you are following. And also let me know if you know how it's been spread, if you have this knowledge about hepatitis B. Before we proceed, please let me know in the comment section if you are following and you understand what we are saying so far. Let me know in the comment section if you are following and you perfectly understand what we have been saying so far in regards to hepatitis B, because I'm still going to be making saying about I'm still going to be giving some live scenarios. We're still going to be talking about the prevention. We're still going to be talking about vaccination. But let me know if you are following. It's very important for me to know that you understand me and I understand you and you are getting the knowledge. Then I will know, okay, it's time to kick forward. So Slim Reselled following. More brains, less muscle said following ma. Okay, that's good. Can I get at least 2-3 people saying followings before I continue? I need at least 2-3 people to say I am following before I continue. And if you, okay, so we have Constance said following. We have First Class Story Channel said, just came across now. Okay, we are talking about hepatitis, and we've talked about the various types of hepatitis, and we also broke down the various type of hepatitis B to be specific, and we finished talking about the mode of transmission of hepatitis B. So if you miss the first aspect, is it that you wait to the end of the video for the revision, or you watch the full video at the end of the live section? So now let's take a moment out of science. I'm going to be sharing a real experience. There's this nurse, let's assume it's Nurse Sandra. Nurse Sandra, like she has been a nurse for a very long period of time. She only found that she had hepatitis during her routine checkup. She has been going to work, taking care of people. She had no symptoms. She felt completely well. She never experienced anything. So we have Worldwide View said following. MD Tusha said, I am following. That is good. So she never had any symptoms. She was doing everything possible. Like she was taking other precautions, but she went for her normal routine checkup and she was shocked when they told her that she had hepatitis B. Like these are real life scenarios. If you don't go for routine checkup, if she had not gone for that routine checkup, she would have not known that she had hepatitis B. So sometimes we feel very healthy, we feel we are okay, we feel nothing is wrong, and we see no reason to actually visit the hospital to check, to do some blood screening. If Nurse Sandra did not go to the hospital for her routine checkup, she would not have known that she had hepatitis B. So this story of Sandra should send you a message for you to do a routine checkup. This story of Sandra should send you a message or should give you a signal for you to book an appointment with your doctor. Yes, even if you are fit and well, at least once a year, do a regular body checkup. I'm talking about the blood. At least if you can't afford the full in total checkup, at least take some blood sample. Let them take some blood samples, analyze it, and tell you your results. Like I will always tell you in my YouTube channel, it is better for the doctor to tell you everything is fine than for you to assume everything is fine and something is missing. Okay, so let's learn from Nurse Sandra's story so we end up not being victims of circumstances. Because when things are detected on time, it's easier to manage. When you notice things on time, it is easier to manage. But when you don't know on time, it's difficult. It might be complicated afterwards. So Ability Monday said, hi, please, I just joined. Can you help explain the meaning of hepatitis B again? Israel, you were here yesterday. Hi, Israel, how are you doing? It's nice having you on our live. It's a whole lot to start explaining everything again. What's going to happen is that for the benefit of those that have been following, what I'm going to do, Ability, is that I will finish up, then I'll give a summary at the end, so you understand. But I would advise you just follow suit. And at the end, I'm going to give you a summary of what I just discussed, okay? MD Tusha, I didn't see your message. Please check my previous message. Please check my previous message. So please help me. Like, how can I talk in English as like you? Please give me suggestions about this. This means, how can I talk in English like you? Read more books. I think read more English books. You read more English books, and yeah, read more English books. Use the dictionary frequently, and that's going to help a lot. All right. So that's what I have to say. So let's go back to our hepatitis. We've talked about the definition. We've talked about the mode of transmission, and we've also shared Nurse Sandra's story. So now the big question, how do I prevent it? How do I prevent this hepatitis B? Let's talk about the best part, and that is the prevention. Hepatitis B is one of the few viral infections that has a safe and effective vaccine. Yes, HIV does not have a vaccine, but you see hepatitis B, it has a safe and effective vaccine. You can protect yourself in simple 3-dose series. Yes, so everybody should get vaccinated. As kids, I believe as babies, all infants, when they are born, it's part of the routine childhood immunization. All kids, when they are born, my 2 kids they've had their immunization. They are being vaccinated for hepatitis B. It is very, very important for you to immunize your kids if you have children at a very tender age. Then if you are an adult or an adolescent, you've not been vaccinated, I would advise you to go to your hospital where they do this vaccination or immunization to get vaccinated. So also adults that are at high risk of contaminating hepatitis B, especially healthcare workers. Healthcare workers, people with multiple sex partner are expected to have the hepatitis B vaccine. Okay, so we have Folashade. Folashade, how are you doing? Trust you are doing great. Sorry. Sorry about that. So, in addition to the vaccine, if you've not been vaccinated, I would advise you to get the vaccine sorted out as soon as possible. Okay, so in addition to the vaccine, it is very important to practice safe sex. The benefits and the importance of practicing safe sex cannot be overemphasized. Avoid sharing your personal items. Yes, it's not just hepatitis, you know, HIV is there. So avoid sharing your personal items. Check medical or tattoo procedures. So any procedure that you are going to be doing that involves cutting your skin, even as small as microblading. Yes, you heard me right. As small as microblading, cutting your skin, tattooing, things that are going to get into your skin and blood is going to come out. You have to be extremely careful. If you are going to microblade your face as a lady, make sure that those things are new. Those razor, those things that are using, make sure that nobody has used it before. If it's something that needs to be sterilized, make sure those things are properly sterilized. And even if you go for a surgery and they didn't sterilize it properly and you get it, you can sue the hospital actually. You can actually sue the hospital because they are the ones that didn't sterilize their properties and now you have hepatitis B. Okay, make sure things are being sterilized properly. Make sure you check those things before you go for it. So one of the major thing I want you to take home is that vaccination is one of the most effective way to actually prevent hepatitis B. But while you are vaccinated, it is also very important for you to practice safe sex. All right, so we're going to be playing a quick game now. So I believe everybody is in. We've talked about it. I really want to check if you understand what I am saying. We're going to be playing a quick game. All you have to do is to drop your answer in the chat. So the first question I want to ask is, you can get hepatitis B from hugging someone. Is that a fact or a fiction? Is that a yes or a no? You can get hepatitis B from hugging someone. Is that a fact or a fiction? Let's see in the comment section. Okay, Progress Jama said a fiction. Worldwide said no, you can't. Okay, is that a fact or a fiction? You can get hepatitis B from hugging someone. So First Class Story Channel said no, you cannot. Okay, I understand. All right. Ability Mode said is a fiction. MD Tusha said no. Nelsie said is a fiction. Progress Gemma said hi. Progress Gemma, thank you for joining our live. And also Diamond Wedlow said, I know it's stinky. I don't know what's stinking actually. So you cannot get hepatitis B from hugging someone or by hugging someone. Okay, that's the answer. To all those that, oh, we got the last one. Brandon Wise said fact. No, it's not a fact. Sorry. Constance Muya said no. No, you can't get hepatitis B by hugging someone. I think you should take note of that in case you missed that. Maybe you missed the first part of our video. You can't get hepatitis B by hugging someone. So it's a fiction. It is not a fact. All right. So the next question is, we are playing a game. You can have hepatitis B. Okay, we are in the next question now. You can have hepatitis B and not know it. You can have hepatitis B and not know it. Is it a fact or a fiction? You can have hepatitis B and not know it. Is it a fact or a fiction? Progress Gemma said fact. Slim said fact. Ability Monday said very possible. Worldwide View said fact. MD Tosh said fact. That's very good. It shows that we are following. That's good. I actually like it. It's a very interacting. So it's actually fact, you can get hepatitis B and not know it. Yeah, that's good. That's to show that everybody is following. So for those that don't know, I think I've talked about the testing, a little bit about the testing. That is, for you to get tested, all they don't need to cut your body. You don't need to go for a surgery. All they need is just to get a little blood sample. They'll just come, take some samples and take it to the lab. And when the results come out, it will tell you, oh, you currently have hepatitis B. It can also tell you if you've had it and it's cleared itself. And it can also tell you if you are vaccinated. So that blood sample they take will tell you if you are vaccinated, if you've had it, and also if you have it. So if you as a lady or a man, you want to know if you have been vaccinated, you are not sure if you are vaccinated, it's better for you to do the blood sample, and that's going to tell you if you are vaccinated. So when they take the blood results, they are going to tell you if you are vaccinated or not. All right. So the big question is, what if you test positive? What if you've run the tests and you've tested positive? What I have to tell you is that you don't have to panic. You get, it's not like when you have hepatitis B, you are going to die. No, you don't have to panic if you have hepatitis B because it can be managed. Like I earlier said, 290 something million people have chronic liver disease worldwide and they are living. So if you have hepatitis B, you don't have to panic. There are a lot of people living with hepatitis B. And like I earlier said, it can be managed. It can be managed. So you don't have to panic. First of all, they are going to give you some antiviral medication if needed. If they see the severity, they'll tell you, okay, you have to take this antiviral medication. The antiviral medication is not to cure it, it's to manage it. So you can also be seeing a liver specialist just to make sure that your livers are not damaged. You have to be checking your liver regularly to know, okay, the amount of effect it has caused on your liver. It's better for you to see a liver specialist, get it checked, and see how it goes. That's also something you should do. Then also eating healthy. Like I always say in this YouTube channel, sometimes we underestimate the benefits of eating healthy. It is very, very important for you to eat healthy. If you find out that you have hepatitis B, eating healthy should be a priority. Taking a lot of veggies, a lot of fruits, healthy food. Make your homemade food. Don't buy food outside. Yes, I usually encourage, except you are sure about the way they are processing their food, about the way they prepare their food in a hygienic environment. Be careful about what you eat outside. And also avoid alcohol. If you have been diagnosed of hepatitis, I know you'll be feeling bad. There are some people, they feel bad, and the next point of action is to get alcohol because alcohol makes them get things out of their head. But no, your next option should not be to get alcohol, but rather to stay far away from anything alcohol and also anything smoking. So you have to be doing regular blood work or ultrasound just to manage the liver damage because hepatitis B, like I earlier said, the liver is inflamed. So you have to be checking, if possible, when you see your doctor, they will tell you how regularly you should be checking so they actually know how far it's gone and what medications they can actually give you. So I think that is more or less like the summary of hepatitis B. So now we are going to be taking questions in regards to hepatitis B. Hepatitis B is being managed. It's managed. It's not a life sentence. It's not a death sentence. It's managed. All right. Just make sure you follow up with your doctor's appointment. Just make sure you get the necessary support. Okay. Ability Mode said, totally understood. That's good. All my students understood this. All right. Okay, I think I should throw a fact or fiction question. What should I ask? Let's see if they're following. Hepatitis B. What should I ask? What should I actually ask? I think we've gotten the basis of what I really said. Please and please drop your questions in the comment section. It's your time for you to ask me questions. As a child, I was immunized. Does this mean I was vaccinated? Yes. If you have the full dose of immunization, yes. It simply means you were vaccinated for hepatitis B. But if you want to check it, just go to the hospital and get your samples examined. It's simple. If you're doubting if the vaccination works, is in your bloodstream or not, go to the hospital, tell them you want to do hepatitis B checkup, or just tell them you want to do checkup generally. They should analyze your blood. It's much easier that way. You give them your sample and they check it. But once you have immunized, you are vaccinated for it. So what you said, my suspicion started when I took a glance at my partner's phone and I saw her asking about hepatitis on Google, only for me to check her phone secretly at night and I saw her WhatsApp private. Wow. Okay, I think the story is not complete yet. What we are waiting for the completion of that story. Vokia said, how does it clear up? Like I said, it cannot be cured. It cannot be cured. It can only be managed. It cannot be cured. It can only be managed. Okay. So first class story channel, I believe you came late, but I'm going to tell you what hepatitis B is. Okay. Because why should I tell you? Okay, because you are my subscriber. I believe you've subscribed. If you've not, better do that. So I'm going to be repeating it again. For those that came late, they're just joining. I'm going to be saying what hepatitis B is. Don't leave if you know you are just coming and you want to know what hepatitis B is. We've explained it before. Okay, at the beginning of the video, I said that hepatitis is the inflammation of the liver. For example, this is the liver. When the liver begins to swell, like it's swelling, it's inflamed, that is hepatitis. And I said that there are different types of hepatitis. There is hepatitis A, B, C, D, and even alcoholic hepatitis, like hepatitis linked to alcohol. So there are different types of hepatitis. But on this particular video, we talked about hepatitis B. And hepatitis B is an inflammation of the liver as a result of hepatitis B virus. So you see something like HBV, hepatitis B virus. So it's an inflammation of the liver. That's the swelling of the liver in the body as a result of hepatitis B virus. And it can be transferred through sexual intercourse, blood transfusion, sharing sharp objects, even toothbrush. So you have to be careful. So these are the ways in which hepatitis B can be transferred. And that is the summary of what we said at the beginning of the video. So first class story channel, I hope this helps. Okay, Gemma Progress said, please, can I ask a question outside the topic? Sure, you can. Sure, you can. We are done. If anybody has a question, they should ask. Be it within or outside the topic, you can ask. And if you are watching this live video, you've gained a lot and you've not double tapped the screen to like this live, what are you waiting for? What are you waiting for? Why not just double tap the screen and like the live video? You buy a lot. Like the video. Like the video. All right, let's keep the questions coming, please. Let's keep the questions coming. Yes, it can be transferred through blood transfusion, but it is rare. It can be transferred through blood transfusion, but it is rare in the sense that before any hospital will do blood transfusion, they actually screen the blood. They make sure that that blood doesn't have hepatitis B, does not have HIV, does not have syphilis, gonorrhea, and all those things. So most bloods in the blood bank, they are being screened. So that is why hepatitis B through blood transfusion can be rare. All right. So Vero Quistri said, please, does being vaccinated protect one from a partner with hepatitis B? It should do, yeah. It protects you, but I would advise you use precautions. I will advise you use precaution. So somebody said, talking about menstrual cycle, can it persist for a week and still be normal? When is it your measles you are talking about? Is it your measles you are talking about? Your measles is supposed to last between 2 to 7 days. If it is more than 7 days, I would advise you to see the doctor. If your measles is lasting more than 7 days, I would advise you to see the doctor. Did you get that, Gemma? Did you get that, Gemma? Vero, did you get the answer to your question? Please let me know in the comment section if you get the answer to your question. Vero, Kwashi, and Progress Gemma. Okay, so Vero Kwashi, I said that yes, it is possible, but the chances are slim. It is possible for you to get infected, but the chances are slim. That is why vaccination is important, because it's more effective. So, Progress German, if your measles is lasting more than 7 days, I would advise you see the doctor. So, Rock says, hello, namaste. Namaste to all my Indians watching right now. Namaste. Then we have Boyika said, you explained that a blood test can show if someone currently has HPV or has had it before and it's no longer. Does it mean that it can go away on its own? Yes, I said that there are two types of hepatitis in my video. I said it when I was explaining it. I said there is acute hepatitis and also there is chronic hepatitis. For acute hepatitis, the body kind of, like the person has it, then the body fights it and the person recovers. You get? So it can go away on its own, but when it becomes chronic, it cannot go away on its own. So the other way, it's two types of hepatitis. So we have What's View continued his story. He said, I went through her phone and I saw a WhatsApp private chat with a doctor that happens to be her friend discussing about the same topic of hepatitis B infection. I saw on her goggling. I saw her goggling on her phone. Okay, I'm following your write-up Worldwide View. One thing I advise is that if you truly love the person you are having a relationship with, it is very, very important for you to tell them about yourself. You tell them if you are infected. It's important for you to tell them, like, before you start having unprotected sex with someone, you don't mean them harm, you don't mean them insult. If possible, both of you should go to a hospital and get your blood screened just to be on the safer side. You are not insulting anyone. You are just being cautious. Okay? Because there are cases of, oh, I didn't know, I trusted my partner, and now she or he has given me this. I think that's where Worldwide View story is going to now. Slimmy said, does this mean the vaccination is not safety guarantee? Follow up on your response of Vero. Yeah, it's not 100%, like it's not 100%, but it is said to be effective. You know, generally, not everything is 100% effective. You get, if you can avoid having sexual encounter with those that are having a disease, avoid it as much as you can. Then also, if you need advice, you can speak with your doctor for personalized advice. All right, it actually protects you against hepatitis B. It protects you against hepatitis B, but the chances are slim. Like, I'm not saying it's a big chance. The chances are slim that you're likely going to get it. So when you get vaccinated, like, it reduces the risk of you being infected. I don't know if I'm making sense. I don't know if I'm making any sense. So I'm going to see. Let's see the next question. Vera said, please, if you are vaccinated but your partner has the virus, can it affect your child and yourself? A doctor once said vaccination may protect you from getting it. Please, if you are vaccinated but your partner has the virus, can it affect your child, your children? It can affect your children if your children are not vaccinated, if your kids are not vaccinated, if they are not immunized. So what I advise you to is that follow up on your kids' immunization. Make sure they are immunized. All right. So that's what I can say. Oh, we have a lot of questions. Aravanga said she's the reason we don't have oxygen in space. Vanguard. So we have Tusha said, ma'am, I have I am addicted to Yeba drugs. Let me know how it will destroy me. Okay, Yeba, I don't know, sorry, Tusha, I don't know about Yeba drugs, but I know being addicted, drug addiction has like a negative impact on your health. Drug addiction has a negative impact on your health. If you want to really stop, it is very important for you to join a support group. It is very, very important for you to join a support group to help you get out of addiction. Addiction is not something you can stop alone. First of all, you have to make that personal decision you want to stop it. And the second thing is that anything in regards to that Yeba drugs that is around you, you have to take it away. Anything that will like make you have that mindset of that Yeba drugs, you have to take it away. You have to look for something more like fun to do whenever you feel that urge to take that drug. Okay, you need emotional support, and you also need probably a therapist or someone that can help you out scale through. So worldwide view said, so I went for checkup the next day and the result shows that I have hepatitis B. So please, nurse, can the hepatitis be clear without any drugs? As an adult I am. Like I earlier said, hepatitis B does not have cure. It can be managed. It can be managed, but it doesn't have a like. This is they cannot say like. I believe research is ongoing, but they can't really pinpoint that. Oh, this is the cure for hepatitis medically, but it can be managed. So what I would advise you to do, worldview, is to go to your doctor. Like I mean, read doctor with experience. I'm not talking like newbies. I mean, doctors with experience, doctors that understand hepatitis, especially the liver doctors. You understand? Have a one-to-one conversation with them. Tell them this is the problem, but what is the solution? What do you advise for me? Because they are the ones that have your results. They are the ones that saw it. They are the one that like you definitely they might advise you do some scan just to see how far it has gone or something. But I think you should go and meet them. Let them give you this personalized care. They might decide to put you on some antiviral drugs, but that medication is to manage it, it's not to cure it. So that's what I have to say. So meet with your doctor. Hey, Manifest, you came late. Manifest, where have you been? Manifest was in our live yesterday. It's nice having you, Manifest. So, and Vero said, thank you. She can smell your thoughts from miles away. So, Vokiwa said, can a person with chronic hepatitis B give birth to a baby and not infect it? Yes. Yes. So if you have hepatitis and you want to have a baby, speak with your doctor. Let them know. There's a way they do this thing. There's a way they can manage it in such a way that your child doesn't have it. So what I would advise you to do is to speak with your doctor. So with proper medical care and planning, your baby will not have it. With proper medical care and planning, your baby is not going to have the hepatitis. All right? So just speak with a doctor, especially when you're trying to conceive. Let them know to be on the safer side. So Tusha said, okay, Ma, thank you so much. You're welcome. All right. I like it when our classes are being interactive, because it's like it makes me want to explain more. It also makes me want to talk more. All right. So what I would advise to do now we'll start thinking about the topic we're going to be discussing tomorrow. So which topic do you want us to discuss tomorrow? Kindly drop in the comment section and we are going to do a poll. All right, same time, 10 p.m. tomorrow, I'm going to be here and we are going to do a poll. What particular topic do you want us to talk about tomorrow? Drop in the comment section. Drop in the comment section and also drop your questions. So I think Vanguard was messing around with me. So Vanguard, be careful. Said, you're beautiful, I'm just messing around. I know you're messing around. You just wanted to distract me, but that's fine. So Sosmita Day said, hello, this is Somita from India. And hello, Somita. I actually have wonderful colleagues from Indians. Yeah. Lolade Yetunde. I actually came live for you yesterday. On that live, I called your name, but you were not there. Yetunde, I told you I was going to come live yesterday to talk about Staphylococcus aureus. So we did the live section and we talked everything about Staphylococcus on the live section yesterday. I was calling your name yesterday. Where is Yetunde? Where is Yetunde? She asked for Staphylococcus aureus, but she's not here. All right. So Yetunde, I would advise you watch the live Staphylococcus aureus. Okay. Yetunde, did you get that? So I just checking. So okay, Yetunde said, yeah. Yeah, I was there. I called your name on the live section. If you can watch it, we talked about it. So I called your name on the live section, but you were not around. I actually did that live section for you yesterday. So Ability Monday said, talk about hepatitis A and tell us the difference between the types of hepatitis. Okay, I cannot remember vividly where all the hepatitis. Let me go back to my school knowledge in nursing. I think hepatitis A is actually transferred through food. Yeah, hepatitis A is transferred through the food we eat, but still the liver is being inflamed. Hepatitis B and C is transferred through body fluid and blood. Then hepatitis D, I think, is transferred through the food we eat. Yeah, but A is transferred through the food we eat. B and C is transferred through sexual intercourse. Blood and body fluid. That's B and C. Then D is transferred through I can't remember. Yeah, but maybe sometimes I will check and let you know. Vero said causes of infertility and low sperm count. Did you do that? Okay. Should we do a live? Okay, causes of infertility and low sperm count. So we're going to be doing a poll. We are going to be doing a poll, and we're going to get people to vote on what we are going to be doing tomorrow. So I'm just going to check the comment section. Area Guard said, sister, I am addicted to vaping. Is it harmful? I am serious now. See, anything addiction is harmful. Anything you are addicted to is harmful. It's more or less like personally, I see addiction as you are putting your life. If you don't do it, you won't be able to breathe. If you don't do it, you won't be able to live. So anything addiction is harmful. Anything addiction is harmful. If you can do away from it, I would advise you do. All right. Yakubu, I can't get your message. I can't get your message, Yakubu. I didn't get your message, Yakubu. Yakubu, I didn't get your message. Okay, hepatitis B, C, and D is transmitted through blood, semen, and other body fluid. But hepatitis A is actually transmitted through the food we eat. So we are going to be doing a poll now. Raha said, you look so beautiful and your voice is so... Thank you very much, Raha. Hello, Black Beauty. Yetunde, thank you. So we are going to be doing a poll now. Are we ready for the poll? That's going to determine what we are going to discuss tomorrow. So I think we have a question from Vanguard, and Vanguard asks, does vaping cause low testosterone, infertility, and erectile dysfunction type of things? Because I don't know yet, but I'm scared of that. Vaping is likely. When I see vaping, I see smoking and vaping as brothers and sisters, kind of. So they usually affect the sperm count. So they affect the sperm count. They are likely going to affect the sperm count. Okay. So that's that. Let me just quickly do the poll before I take other questions. I'll quickly do the poll. So for tomorrow's topic, we got Vero said we should talk about causes of infertility and low sperm count, and somebody said we should talk about arthritis or asthma. Okay, I'm just going to do a poll. Then what again? Arthritis, asthma, causes of low sperm count. So we're going to get a pool now. Just give me some time. Let me do the pool. I'm supposed to have done the pool. Topic for tomorrow. Causes of low sperm count. Asthma, arthritis, asthma, and arthritis. Please, let's just wait. I'm supposed to have done this pool. So we're going to do the pool now. Please, everybody, try to answer the pool. So that first one is causes of low sperm count and infertility. So just vote and let us know what you want us to talk about. Let's know what you want us to talk about in the comment section. Please vote for tomorrow live. So what have you said? But nurse, what's not the point of acute and chronic if hepatitis B is not curable? Because you said earlier that hepatitis B can go away. I said there are some hepatitis that the body fights and it goes away, and that is the acute type of hepatitis. And also, you didn't let me know if you have the acute or the chronic hepatitis. So that is why visiting a doctor is going to go a long way to help. Because acute hepatitis, the body fights it. The body is it's a medication, and your liver goes back as if nothing happens because it's acute. But with chronic, it can lead to liver damage, liver cirrhosis, and liver cancer. So that's the difference between acute hepatitis and chronic hepatitis. I don't know if you are cleared what view. See, personally, what view? Remember yesterday you talked about, you said you had staphylococcus and Hep B. So what I would advise you to do personally, you need a personalized, you need to speak with a doctor for them to give you a personalized advice in regards to that. Because I am not there with you, I am not with your test results, and I can't really pinpoint what you need. So this is more or less like a general education to let you know what it is, but not necessarily like I'm prescribing and telling you this is what is going to cure it, or this is what's going to make you feel better. All right. So we have Vanguard said, I'm going to get married in a year and I'm worried. Yeah, if you're going to get married and you intend on getting pregnant, if you can stop vaping, quit vaping, or you start reducing it little at a time, not just like vaping. If you vape like 10 times a day, you can reduce it to 4, you can reduce it to 9. From 9 it becomes 8. If you can do 8, you can do 7. If you can do 7, you can do 6. If possible, try and keep it coming like that. Please and please, let's keep voting in the poll. I think now 75% said we should talk about causes of low sperm counts. 17% says asthma, and 8% says arthritis. So what's going to happen? I think Manifest was asking about asthma in my last live video. So I might talk about causes of low sperm count alongside with asthma tomorrow. So because she came yesterday, she asked that same question, and today she's asking that same question. But from the poll so far, 75% want us to talk about the causes of low sperm count. So what I would advise you is that subscribe. If this is the first time you are coming across this YouTube channel, all you have to do is to subscribe to the YouTube channel, turn on that notification bell, subscribe, turn on that notification bell, because once we come live tomorrow, you get notification and you join us. But hopefully it's going to be by 10 p.m. latest, 10 p.m. I might come earlier, but 10 p.m. latest, I should be online to talk about the causes of low sperm count tomorrow. So from the poll so far, 75% want us to talk about low sperm count. So we have Robert. Robert said, thank you for your services. You're welcome, Robert. So let's keep the questions coming. I might be going offline. in the next 5-10 minutes if there's no question, because the live is supposed to last for 1 hour and now we've spent 55 minutes, and that's good. So feel free to drop your questions. We've taken all the questions in the comment section now, and I have been talking for the past 56 minutes. So feel free to drop in the next 5 minutes if you have any other question. Worldwide view, I don't know if you understand my own perspective. For you to see the doctor, to just get insulted at and be at peace. I'm sorry your girlfriend had to put you in that mess. I'm really sorry about that. It's increasing. Causes of low sperm count. The votes are increasing. The vote is increasing for causes of low sperm count. Now we have 17% wants us to talk about causes of low sperm count. All right, Worldview. I wish you the very best, sincerely. I wish you the very, very best. And I hope you get the treatment and you bounce back as soon as possible. And how are you able to speak with your manager? Were you able to speak with your manager about the health or? Brainiac, how are you? How are you doing? And let me introduce myself formally again for those that are just joining us for the first time. My name is Nurse Mercy Mary. I am a registered nurse and also a registered midwife in Nigeria, but I'm currently practicing as a registered adult nurse in the United Kingdom. So what I do here is to talk about your health. Those questions that you are shy to ask your doctors, just bring it to nurses lecture room table. And also, if your doctors or your nurses, they explain things to you and you don't understand, all you have to do is to ask that question on our YouTube channel and on our live series, and we will be able to answer it for you. Okay, so now this topic is very crucial, like low sperm count. Yes, it's obvious because 77% of the audience want us to talk about low sperm count. So tomorrow by 10 p.m. I will be live to talk about the causes of low sperm count. It's a very, very important topic for our men. And if you are new on this channel, all I advise you to do is to subscribe, like, and also share. Share to your friends, because here we talk about health. If you value your friends and you value their health and you know they might be having some disturbing questions they want to ask, all you have to do is to tell them to follow Nurses Lecture Room and join our live sections to ask their questions. So I'm going to be seeing everybody tomorrow, hopefully, fingers crossed. So Worldwide View said, a question outside this topic. What about inching after baiting? Because I told my mom some decades ago and she said it usually happens to my father sometimes. Inching after baiting, sometimes it might be as a result of change in environment, some skin allergies. Yeah, that's what I think. Change in environment, skin allergies might be the cause of that skin inching. I am not a dermatologist, so I can't really give useful advice in regards to that. Yakubu said, you don't respond to my question, and for this, it seems I'm not welcome here. You are. It's possible your questions are violating YouTube policy. So what I would advise you, if there is a way you can modify your questions, because sometimes when your question violates YouTube policies, it kind of affects, it doesn't show up. It doesn't show up on the comment section, and I can't get it. All right. So that's why I answer all the questions I've seen here so far. So MD Tusha said, this is the first time in the channel and I'm already subscribed. Thank you very much for subscribing. If you are new on our YouTube channel, all you have to do is to subscribe to the YouTube channel. So, Yakubu, the live will be ending soon. I believe probably your questions are going against YouTube policy, because I'm not seeing your questions on my live section here. So I believe most people are not seeing any question from Yakubu. We are going to be ending the live now. It's a 1 hour live. So we are going to be ending this live. Don't forget to subscribe. Don't forget to like. And also don't forget to share this channel with your loved ones. Bye and see you in tomorrow. See you tomorrow.